Hi friends, welcome to the channel The Nurse. Here we are discussing some scenario based nursing questions and answers with their explanations. So it will be helpful for preparing AIIMS NORCET 5 main exams. So as you know, there will be two exams in coming AIIMS NORCET, that is preliminary exam and main exams. So this scenario based questions will help you to prepare upcoming main exams. So we will move to the topic. Before that, if you are not subscribed to our channel, please subscribe and we will move to the topic, that is scenario based questions. AIIMS NORCET 5 Scenario Based MCQs 2023. This is second part. First question we will discuss here. You are not a pilot. You are a pilot flying at a high altitude and suddenly you start experiencing confusion, dizziness and shortness of breath. What is the most likely cause of these symptoms? Carbon monoxide poisoning, dehydration, hypoxia, motion sickness. Here correct answer is hypoxia. So in high altitude, there will be chance of occurrence of hypoxia. At high altitude, the oxygen levels in the air are lower, leading to a condition called hypoxia. The symptoms mentioned confusion, dizziness and shortness of breath are classic signs of hypoxia due to inadequate oxygen supply to the body and brain. So I will tell you the classification of hypoxia in coming questions. So this in high altitude there is a chance of occurring hypoxia due to the low supply of oxygen, low levels of oxygen. Second question: shortly after giving birth, a mother experiences heavy bleeding that saturate a pad within 15 minutes, accompanied by a rapid heart rate and a low blood pressure. What is the most likely cause of these symptoms? Uterine atony, placental abruption, cervical laceration, placenta previa. Correct answer is uterine atony. So that uterine involution will not occur here. The tonicity, it is not changing to, it is pre-pregnancy state. So because of that, there will be a chance of large amount of bleeding. Uterine atony is the most common cause of postpartum hemorrhage. So one of the cause of postpartum hemorrhage is uterine atony. It refers to the inability of the uterus to contract effectively after childbirth. That means uterus is not coming to its pre-pregnancy state. The muscle will be in a stagnant state. So it will leads to the continuous bleeding. If uterus coming to its normal state means its muscle will be contracted. Then blood vessels automatically contract and compressed. So bleeding will stop automatically according to the uterine involution. So here uterine involution is not occurring, muscle contraction is not occurring. So the bleeding blood vessels continuously it will bleed. So it will leads to a large amount of blood loss. Symptoms like heavy bleeding, rapid heart rate, and low blood pressure are indicative of severe postpartum hemorrhage due to uterine atony. Third question: during a scuba diving session, a diver descends to a considerable depth. As the diver goes deeper, they might experience which type of hypoxia? So here I will discuss a different kind of hypoxia. So here options are hypoxic hypoxia, hypemic hypoxia, stagnant hypoxia, histotoxic hypoxia. Here correct answer is stagnant hypoxia. Stagnant hypoxia means the blood is not moving to the cells. From the oxygen is carried through the arteries. So this through the artery, the blood is not moving into the cells because of the high pressure in the deeper sea. So that kind of hypoxia is known as stagnant hypoxia. I will explain little more. Stagnant hypoxia occurs when there is a reduced blood flow to the body tissues. Reduced blood flow due to high pressure. So the in that condition, the tissue cells it will not receive adequate oxygen. Even there is a adequate supply of oxygen, because of high pressure to the body. The blood will not move through the blood vessels. In scuba diving, as the diver goes deeper, there is an increased pressure which can leads to blood vessel constriction and a reduced blood flow, causing stagnant hypoxia. So due to the high pressure in deeper water, so the scuba diver will get their blood vessel contracted. So this constriction leads to reduced blood flow to distal tissues. So that will leads to stagnant hypoxia. There is another type of hypoxia mentioned in option, that is histotoxic hypoxia. Histo means cells. Histotoxic hypoxia means it is a condition where cells cannot use oxygen properly even though there is enough oxygen supply in the blood. So if blood is carried till the tissues, after that also tissue is unable to use or unable to use the oxygen properly for making energy. So in that condition, it is known as histotoxic hypoxia. So main example for histotoxic hypoxia is due to cyanide poisoning. After cyanide poisoning, the ATP synthesis or tissue usage of oxygen, that will be there will be some problems and tissues cannot use that proper oxygen. So that will leads to histotoxic hypoxia. Histo related to tissue. And then another kind of hypoxia we have discussed in question, that is hypemic hypoxia. Hypemic hypoxia means it occurs blood is not able to carry sufficient amount of oxygen. Hypemic hypoxia means blood is not unable to carry sufficient amount of oxygen. That in the case of there is a anemia. In the anemic condition, there will be reduced hemoglobin level. So that less number of hemoglobin will carry less number of oxygen to the tissues. So that is what occurring in hypemic hypoxia. So I have explained three types of hypoxia here: stagnant hypoxia and histotoxic hypoxia. Then third one is hypemic hypoxia. Hypemic hypoxia main examples are main causes are anemia, some disease conditions, and severe blood loss, deformed blood cells, or carbon monoxide poisoning. These are the condition causing hypemic hypoxia. Histotoxic hypoxia, the main cause is cyanide poisoning. Fourth question: a woman in her third trimester of pregnancy experiences sudden severe abdominal pain and vaginal bleeding. On examination, her uterus is tender and firm. What condition could be causing these symptoms? Uterine atony, placental abruption, cervical laceration, placenta previa. So here you need to see the symptoms, then only you can answer the questions. There is a confusing options. Here correct answer is placental abruption, and placenta previa and placental abruption both are occurs at third trimester, but here it is clearly mentioned severe abdominal pain. So in the placenta previa, there will be the characteristic feature of pain is it will be painless bleeding. In the case of abruptio placenta, there will be severe pain. So that is a main feature differentiating placenta previa and abruptio placenta. So you can easily find the answer here. Placental abruption occurs when the placenta separates from the uterine wall before delivery. It can lead to severe abdominal pain, vaginal bleeding, and uterine tenderness. The firm uterus indicates concealed bleeding within the uterus. Firm uterus means concealed. The bleeding, it is not coming out properly. So that means the uterus will be firm. While palpating, the uterus will be firm, like a round globe-like feature will be there while palpation. Fifth question: a mountaineer is climbing a high peak, and as they ascend, they start feeling lightheaded, nauseous, and have difficulty concentrating. What could be the cause of these symptoms: high altitude pulmonary edema, hypoxic hypoxia, hypemic hypoxia, decompression sickness. So in the similar case, we have explained in first question also, that is a pilot experience. So here also same condition only. It is here a mountaineer is climbing a high peak. The situation is similar here. So in this case, the correct answer is hypoxic hypoxia. In high altitude, there is a chance of hypoxic hypoxia. The pilot also occurs the same kind of hypoxia only, hypoxic hypoxia. So we will explain furthermore. Hypoxic hypoxia occurs when there is a lack of oxygen available for the body due to the reduced pressure at high altitudes. The symptoms described, lightheadedness, nausea, difficulty concentrating, are common manifestations of hypoxic hypoxia in high altitude environment. And other options we already explained, that is stagnant hypoxia, hypemic hypoxia, and histotoxic hypoxia. So here I have explained four types of hypoxia. So I think you understand very well that terms: hypoxic hypoxia, stagnant hypoxia, hypemic hypoxia, and histotoxic hypoxia. Sixth question: a woman who recently gave birth start experience dizziness, pallor, and a drop in blood pressure. Her bleeding is continuous but not excessive. What could be causing these symptoms? Uterine atony, placental abruption, cervical laceration, retained placenta fragments. So correct answer is retained placenta fragments. So here how you will differentiate uterine atony and the symptoms of uterine atony and retained placenta fragments. So in this question, only one symptom that is differentiating from uterine atony and retained placenta. That is, patient is experiencing continuous bleeding, but it is not a severe type. So that kind of bleeding is seen in retained placenta fragments. But in the case of uterine atony, there will be severe bleeding. So that is a difference between difference of symptoms between uterine atony and retained placenta fragments. Retained placenta fragments can lead to continuous moderate bleeding. Symptoms like dizziness, pallor, and drop in blood pressure are signs of gradual blood loss. So that means that is symptoms of shock, hypovolemic shock. This condition requires prompt medical attention to remove the retained placental tissue. Seventh question: a pilot in a pressurized cabin experiences a sudden loss of cabin pressure. What type of hypoxia could the pilot potentially encounter? So here a light difference is there. There is a sudden loss of cabin pressure. So what will happen in that condition? Stagnant hypoxia, hypemic hypoxia, hypoxic hypoxia, histotoxic hypoxia. So correct answer is stagnant hypoxia will be there because of high pressure. The blood will not reach into the tissues. Stagnant hypoxia, I already explained, it occurs when there is a reduced blood flow to the body tissues. In a pressurized cabin, sudden loss of cabin pressure can lead to decreased blood flow due to expansion of gases causing stagnant hypoxia. Eighth question: a long distance runner has been participating in a marathon on a hot day. After the race, they start experiencing confusion, nausea, and muscle cramps. What could be the potential cause of these symptoms? Dehydration, hypernatremia, hypokalemia, hyponatremia. Correct answer is hyponatremia. Hyponatremia is a correct answer here. Hyponatremia is wrong here. Correct answer is hyponatremia. Hyponatremia refers to low levels of sodium in the blood, which can occur due to excessive fluid intake without adequate sodium replacement. So during the whole day, the runner will drink excessive water without taking adequate electrolyte replacement. It will leads to hyponatremia. The symptoms includes confusion, nausea, and muscle cramps are common signs of hyponatremia, often seen in endurance athletes who consume large amounts of water without enough electrolytes intake. Ninth question. A person with a history of lung disease experiences difficulty breathing and confusion. Their lips and fingertips have turned bluish. What type of hypoxia might be affecting this individual? Stagnant hypoxia, hypoxic hypoxia, hypoxia, histotoxic hypoxia. So here and on you can answer easily. So because I have explained all four types of hypoxia in previous questions. So you can answer here. Correct answer is hypoxic hypoxia. In lung disease, there will be decreased supply of oxygen to the tissues, or the body is not getting adequate oxygen because of lung disease. Either that is due to uh, uh, respiratory tract problems, or due to the disease conditions like pneumonia, tuberculosis like disease condition will impair the oxygen exchange. So this will leads to hypoxic hypoxia. Hypoxia results from lack of oxygen supply to body tissues. In cases of lung disease or impaired lung function, the person might not be able to effectively oxygenate their blood, leading to low oxygen levels in the body. The bluish colors of the lips and fingertips, that is cyanosis, is a classic sign of hypoxia due to inadequate oxygenation. The hypoxia is a critical condition that requires immediate attention. If you suspect someone is experiencing hypoxia, it is important to address the situation promptly by providing supplemental oxygen and seeking medical help if necessary. Otherwise, patient will go to cardiac arrest. 10th question. A person experiences intense episodes of anger and aggression, which they later have little to no memory of. What psychological condition might explain this pattern? Dissociative identity disorder, bipolar disorder, antisocial personality disorder, intermittent explosive disorder. Correct answer is dissociative identity disorder. Previously, it is known as multiple personality disorder. So I will explain here what is dissociative identity disorder. It is formerly known as multi-personality disorder. It involves the presence of two or more distinct identity states that control an individual's behavior along with memory gaps. The person will not remember what happens in previous state of dissociation. The aggressive episodes with memory loss align with the characteristics of this dissociative identity disorder. Then 11th question. A patient with heart failure is taking diuretic to manage fluid retention. They start complaining of headache, fatigue, and a difficulty concentrating. What electrolyte imbalance might be contributing to these symptoms? Hyperkalemia, hypercalcemia, hypernatremia, hyponatremia. Here also correct answer is hyponatremia. Hyponatremia is contributing factor to the following symptoms like headache, fatigue, difficulty concentrating. Diuretics can lead to excessive loss of sodium through urine, which can result in hyponatremia. Along with there will be hypokalemia, but there is a chance of occurring hyponatremia also. Main side effect of diuretic is hypokalemia, but at the same time there will be chance of occurring hyponatremia. The symptoms described headache, fatigue, and difficulty concentrating are typical manifestations of low sodium levels in the blood, that is hyponatremia. 12th question. In a crowded social gathering, a person becomes increasingly agitated, starts yelling, and throws a drink at someone after a minor disagreement. What could be the underlying factor contributing to this behavior? Bipolar disorder, social anxiety, schizophrenia, intermittent explosive disorder. Correct answer is Option D, that is intermittent explosive disorder. So what is intermittent explosive disorder? It is a characterized by sudden outbursts of anger, aggression, and violence that are out of proportion to the situation. Even for minor disagreement, the patient will be mainly very aggressive and violent. So in that condition, it is known as intermittent explosive disorder. Means it is misproportion to the situation. That kind of behavior. In this scenario, the person's extreme reaction after a minor disagreement suggests a potential case of intermittent explosive disorders. 13. A hiker who has been sweating profusely during a long trek suddenly collapses and becomes disoriented. Their skin is cool and clammy. What could be the underlying condition causing these symptoms? Heat stroke, hypokalemia, hyponatremia, dehydration. Here also correct answer is hyponatremia. Hyponatremia will leads to the skin will be cool and clammy. Excessive sweating can lead to both fluid and electrolyte loss, including sodium. Hyponatremia can occur when the sodium loss is significant level. The collapse, disorientation, and cool or clammy skin could be indicative of severe hyponatremia. Mainly in hyponatremia, there will be disorientation, neurological problem will be there. So that is the main thing. A child is often seen bullying and physically attacking their classmates, seemingly without reason. What psychological condition might be contributing to this behavior? Conduct disorder, attention deficit hyperactivity disorder, oppositional defiant disorder, autism spectrum disorder. Correct answer is conduct disorder. What is conduct disorder? That involves persistent patterns of aggressive behavior that violate the rights of other children. Bullying and physical attacks are common manifestations of this disorder, making it the most likely explanation for the child's behavior. Then 15th question, a patient with chronic kidney disease is receiving hemodialysis. After a recent session, they experience nausea, vomiting, headache, and muscle weakness. What might be the cause of these post-dialysis symptoms? Hypernatremia, hypophosphatemia, uremia, hyponatremia. Correct answer here, hyponatremia. Hemodialysis involves removing waste products and excess fluids from the blood. If the rate of fluid removal is too rapid, it can lead to hyponatremia, causing symptoms like nausea, vomiting, headache, and muscle weakness. Nausea, vomiting are common symptoms of hemodialysis during the time of hemodialysis. 16th question. A person has a history of substance abuse and frequently engages in fights and aggressive confrontations while under the influence of alcohol. What term is commonly used to describe this phenomenon? Narcissistic personality disorder, antisocial personality disorder, borderline personality disorder, dissociative identity disorder. Anyway, we can easily involve dissociative identity disorder. We have already discussed dissociative identity disorder in previous questions, so we can exclude this option. So other three options you can find the answer. Correct answer here, antisocial personality disorder. Antisocial personality disorder is characterized by a disregard for the rights of others, impulsivity, and aggressive behaviors. The same time, the substance abuse or alcoholism, it will exacerbate these traits, leading to violent confrontation and fights. So if person already having antisocial personality disorder, he has taken alcohol excessively, it will exacerbate these behavior patterns like violent behavior or aggressions, etc. Then 17th question. An elderly patient on multiple medications including diuretics is admitted to the hospital with confusion, irritability, and a shaky tremor. What could be the likely electrolyte imbalance contributing to these neurological symptoms? Hypomagnesemia, hypocalcemia, hypernatremia, hyponatremia. The correct answer is hyponatremia. In elderly patients, medications interactions and age-related changes can contribute to hyponatremia. The described symptoms, that is, confusions, irritability, and shaky tremor, are indicative of the neurological effects of low sodium levels in the blood. Last question. A teenager who is usually calm starts showing aggressive tendencies, isolates themselves, and frequently write about revenge in a journal. What psychological condition could be at play? Generalized anxiety disorder, major depressive disorder, borderline personality disorder, reactive attachment disorder. Correct answer is borderline personality disorder. So we can see what are the symptoms of borderline personality disorder. It is characterized by unstable moods, impulsivity, self-isolation, and intense and unstable relationships. The mentioned aggressive tendencies and thoughts of revenge align with the symptoms of borderline personality disorder. So that is about today's video. We have discussed 18 questions here. So I think you have understood some scenario based questions regarding hypoxia and some psychiatric conditions and some OBG related conditions. So you can easily go through the questions and you can understand. So what are the scenarios you are facing in hospital and what will be the expected interventions needed. So these are the skills you need to acquire during your hospital posting or your working time. You may face these scenarios and you need to implement the proper interventions. So that is why AIIMS is included the scenario based questions in main exam. So if you have any doubt means you can ask in comment section. So I will explain explain there. So thank you for watching this video. Bye bye.